Back now with the health news story we mentioned. After years of assuming more care is always better, 9 medical societies, including the nation's cancer doctors and heart specialists, are now recommending fewer routine tests and procedures. The story tonight from our chief medical editor, Dr. Nancy Snyderman.
Fewer EKGs during routine physicals, waiting longer between colonoscopies. Those are just 2 of the dozens of recommendations from a cross-section of medical experts and consumer advocates joining forces.
The primary goal is to improve care and to prevent patients from harm that they might encounter unnecessarily.
Of an estimated $2 trillion a year spent on health care in America, some say up to a third goes to treatments, tests, and procedures that are unnecessary and could be potentially harmful. Among the 45 recommendations medical groups unveiled today, skipping MRIs in certain cases of lower back pain or simple headaches, not getting a CT scan just because you faint, saying no to antibiotics to treat mild sinusitis, and passing on a routine chest x-ray before minor surgery.
Very rarely on a chest x-ray do we find something for somebody who feels well, but meanwhile we've added a significant cost, and more importantly, we've exposed the patient unnecessarily to radiation.
Still, some people prefer to err on the side of caution.
I had a friend who did not get that kind of testing, and 3 years later found out she had cancer.
It was helpful to say, you know what, I had these tests. We've, eliminated 10 things that I could have had.
Even physicians who agree with the recommendations admit that this sort of thinking could make following them challenging.
You should not do the test for everybody if we're only benefiting a very small percent. Nonetheless, if you're one of the people who was benefited, you might feel very strongly about it, and you might be very glad that you had that test.
We hope that by having more informed patients and better conversations between doctors and patients, that we can reduce the risk to patients of unnecessary procedures and also reduce waste in the system.
The ultimate goal is to improve health care, not necessarily by spending more, but spending better. Today's recommendations are not a one-size-fits-all, but a reminder that if we avoid certain tests that may be unnecessary and pose some risks, then there's going to be more in the bank for the people who really need health care. And frankly, we're all going to be a lot healthier for it, Brian.
It's an idea we may have to get a hold of in this country. Nancy, thank you, as always.